No one was injured in the making of this movie. Some names and facts have been modified to protect the identity of the individuals. This is a reenactment and is for information and education purposes only. If you or a loved one are displaying or experiencing any signs or symptoms or life-threatening conditions, please seek the advice of a physician. Hello, this is Henrietta, or as her friends and family commonly call her, Hern. She's 34 years young, weighing in at 180 pounds, at a height of 5 feet 8 inches. Here are some things you should know about little Hern. Her body mass index is 27.5 kgs per meter squared. In other words, she is overweight. She is a nurse by day and truck driver by night. She spends a lot of time sitting and bending over. Most often than not, she uses poor posture and incorrect lifting methods. She is considered sedentary, only working out once a week with her awesome personal trainer for a total of 30 minutes. That's a tough load. She also loves taking long, luxurious walks to her fridge and eating delicate pastries. Now that you know a little bit about Hern, you are now ready to hear the rest of her spine-tingling story. It all started one fine, crisp day at the gym. Hern was working out doing those sexy deadlifts when she used improper form and stressed her low back. Hern immediately felt a sharp, stabbing feeling in her low back, but shook it off, being the absolute stud muffin that she is. She thought, wow, am I going to be sore tomorrow? However, Henrietta doesn't know that she has herniated one of her vertebral discs, specifically between her L4 and L5 in her lower back or lumbar region. Stay tuned to find out if her herniated disc will affect her sexiness in the long run.
The Tummy Tuck Slimming System with the revolutionary Tummy Tuck Belt that instantly erases inches and melts fat away from your belly every time you wear it. Best of all, this accelerated fat-burning miracle works even by wearing the belt twice a day for as little as 10 minutes.
First, we will start off by taking a trip down her spinal column to the notorious herniated disc.
Between each vertebrae in the lumbar spine, there is a fibrocartilaginous disc that acts like a cushion, shock absorber, and/or spacer, which is here depicted in blue. Each disc has two components. The central part of the disc has a gel-like consistency depicted in red, called the nucleus, and the outer ring of the disc, depicted in white, is a tougher, fibrous material with multiple layers adding to its strength. The fibrous annulus holds the gel nucleus within its walls. The walls of the annulus ring commonly crack or tear. The cracks or tears are warning signs of what will follow. The early symptom of a crack or tear will normally be low back pain, sharp in character, which is present with forward bending. The low back pain fades over time, but the initial crack or tear starts the disc degenerative process. Over time, this outer wall gets weaker and weaker until with common daily activity, the annulus ring breaks and the nucleus bulges or herniates through the ring. When the disc bulges into the vertebral canal, it will irritate the spinal nerve and severe low back pain, sciatic nerve pain, and muscle spasm will often follow.
Herniated disc can be caused by a degenerative process due to loss of water content and weakening of the intervertebral disc, specifically the annulus fibrosus. Core weakness, sedentary lifestyle, being overweight, and injury are also precursors to disc herniation. The most common population impacted by this injury is individuals aged 30 to 50 years old. Additionally, men tend to be at a higher risk than women at developing a herniated disc. Although a herniated disc can take place at any vertebral disc, the most common occur between L4, L5, and the sacrum. There are many mechanisms that could lead to herniated discs or an increased risk for herniating a disc. Once a disc is fractured or degenerated to a certain degree, anything can lead to a rupture. It can even be set off by something as harmless as a sneeze.
So yeah, we need to do
Chronic in nature, physically demanding occupations and history of pressure on vertebral discs commonly contribute to a disc rupture. However, herniated disc injury can also occur acutely via car accident, abrupt direct force, and/or harsh twisting that can cause abruption to the annulus fibrosus of the intervertebral disc. Contact sports that may lead to or increase the risk of disc herniation include, but are not limited to, football, rugby, soccer, and basketball. Non-contact sports that may lead to or increase the risk of disc herniation include, but are not limited to, tennis, baseball, and gymnastics. Although these sports do not involve forceful contact from other players, they do involve motions that could result in injury if done incorrectly, as well as motions that put stress on their bodies. These sports can lead to constant wear and tear on the athlete's body, putting them at high risk for herniation of their vertebral disc.
However, you do not have to partake in athletic activities or be an athlete to herniate a disc. Performing certain exercises incorrectly could also lead to increased risk of disc herniation. Some of these include, but are not limited to, harsh twisting, back extension, overhead press, and overhead press and squats. When a disc is herniated, it can often be mistaken as low back pain. However, there are certain symptoms that can separate a herniated disc from just back pain. Some of the symptoms displayed are low back pain, pain and numbness on one side of the body, pain extending down your leg to your toes, which could be sciatica if the pulpus is compressing against the nerves, pain that worsens after standing or sitting for a long period of time, pain when walking short distances, and tingling, aching, or burning sensations in the affected area.
Massage therapist. Sometimes I work in a chiropractic facility and sometimes I work independently. I'm here to work on your muscles around where your lower back pain might be. The muscles include the large paired muscles in the lower back, which are the erector spinae, which help hold up the spine, and gluteal muscles, which also help you stay erect and also protect your lower back. The flexor muscles are attached to the anterior or the front of your spine, which include the abdominal muscles and enable flexing, bending forward, lifting, and arching the lower back, kind of the way that you hurt your lower back already. A series of techniques that I can work on with you are Swedish, deep tissue, myofascial release, and Reiki. They help relax you, decrease inflammation, loosen trapped nerve, and overall help you decrease your pain. Hi, I'm a chiropractor. Sometimes you'll come to me after a massage therapist after they loosen up your muscles, because I work on the bones. A chiropractor could help with your herniated disc, which is also called a slip disc or a ruptured disc. The majority of spinal disc herniations occur in the lumbar region, 95% in the L4 to L5 or L5 and S1. The second most common site is the cervical region, C5 to C6 or C6 and C7. Spinal decompression, traction, E-stim, X-ray to show your spinal alignment and realign off pinched nerves and decrease pain overall can help with chiropractic.
Hi, I am a general physician and I am here to help figure out what is causing your symptoms. The first thing I will do is look at your medical history. After this, I will ask about your symptoms and what you were doing when you started to exhibit those symptoms. After hearing symptoms such as numbness or tingling sensation in your leg, pain shooting down your leg, and back pain in the lower region of your back, some red flags may be raised. I may make an initial diagnosis that you may have a herniated disc. To further test or confirm my initial diagnosis, I will perform some neurological examinations and palpate on you to assess for muscle weakness or sensory loss. The first test I may perform is the straight leg raise test. This test is used to reproduce pain down the leg of the affected side and below the knee. This is a good indicator of whether a disc has been herniated for those under the age of 35. After this, you may be asked to walk on your heels and toes to assess for muscle weakness. And last but not least, I may perform light palpation and knee reflexes to assess for sensory loss. After these tests have supported my initial diagnosis of a herniated disc, which they have, you will be sent to get an MRI to confirm the test findings. This MRI image does indeed show that you have a herniated disc. I will refer you to Dr. Lee, an orthopedic surgeon, to discuss your options.
Hello, Henrietta. I'm your surgeon, Dr. Lee. Okay, Gina, so you went and met with Dr. Stevens because you were having some symptoms that were in your low back, pain. She prescribed you some physical therapy and some not personal training, but some chiropractor. You went to see the chiropractor and you went to the massage therapist, right?
Yes.
Okay. We did 6 weeks of therapy and you're still having pain, so we're going to go ahead and take a look at surgery. So I'll be your surgeon. I'm Adrienne Lee. We'll do a discectomy, and it'll be a micro discectomy, so I'll just make a small incision in the midline of your back. With that, you should be out within maybe 5 days being in the hospital. If there are complications, we might do a fusion. That's only if you're not very stable. What that is I'll just take a bone graft and I'll fuse a couple of your bones in your low back. You'll be fine. You'll only stay in the hospital a couple more days. It's not a big deal. You'll go to physical therapy after that. One of the things that you can do, you can get a second opinion if you want to. I wouldn't be offended or anything. But if you do meet a doctor and they tell you that they want to do a radical surgery on you, do not do that at all. That's taking the complete bone out of your back. You don't need that at all. They might offer you a laminectomy, which that is taking the bone that covers the nerve, and that's just leaving some space so that your disc can breathe and stuff like that. But I'd rather do a discectomy, and that's where I'll just take some of that damaged vertebrae out. No big deal. So just let me know what you think. Go see that second opinion. Come back and talk to us. I'll be more than happy to do it for you, and we'll see how it goes, okay?
Okay.
All
Thank
right.
you, doctor. Appreciate it.
Hi, I'm Andy. As your physical therapist, I will work with you to develop a plan that best suits you, specific to your diagnosis and health history. Physical therapy often plays a major role in herniated disc recovery. Its methods not only offer immediate pain relief, but they also teach you how to condition your body to prevent further injury. There are a variety of physical therapy techniques. Passive treatments relax your body and include deep tissue massage, hot and cold therapy, electrical stimulation, and hydrotherapy. Active treatments help address flexibility, posture, strength, core stability, and joint movement. An exercise program may be prescribed to achieve optimal results. This will not only curb recurrent pain, but will also benefit your overall health. Your physical therapy program will usually begin with passive treatments, but once your body heals, you will start those active treatments that strengthen your body and prevent further pain. As your physical therapist, I will teach you ways to condition and strengthen your back to help prevent future pain. You may learn self-care principles so you understand how to best treat your symptoms. The ultimate goal is for you to develop the knowledge to maintain a pain-free lifestyle. It's essential that you learn how to exercise and condition your back after the formal physical therapy ends. If you don't implement the lessons you learn during physical therapy, you won't enjoy its long-term results. By taking care of your back on your own, you may prevent further herniated disc pain.
Most patients with a herniated disc notice improvement over the first several weeks following surgery, but may also experience continued improvement over several months. Pain is typically the first symptom to improve, followed by improvement in overall strength of the leg and then sensation. It is common for some patients to state that although pain symptoms are better, they still have a numb spot on their leg or foot. Most patients will slowly resume normal daily activities over the first several weeks following surgery and generally will be able to live a happy and meaningful life. When trying to prevent back injury, it can be accomplished multiple ways, such as keeping weight under control and lose excess weight if possible.
Partake in regular exercise, including exercises that strengthen the abdominal muscles. Pay careful attention to posture when sitting for long periods of time while working or driving, and use common sense when stooping, bending, lifting, or carrying objects. Use of the legs for lifting rather than the back is key.